Hello everyone, my name is Araceli Delgadillo and welcome to my presentation on obesity in Mexican American children of El Paso, Texas. So first I'd like to give you an overview on childhood obesity. Childhood obesity is defined as a BMI at or above the 95th percentile for children of same age and sex. And currently in the United States, the national childhood obesity rate is 18.5%. Here on the screen, you can see that we have different age groups. And for example, for children ages 2 to 5 years of age, currently it is estimated that 13.9% of that population is obese. For children who fall in the age range of 6 to 11, it is estimated that 18.5% of that population is obese. And for children ages 12 to 19, it is estimated that 20.6% of that population is obese. And this is an issue because since 1980, obesity rates in the United States have quadrupled from 5% to 20.6%. In the United States, childhood obesity is estimated to cost $14 billion in health expenses. So as we can see, this is definitely a very alarming public health concern. So what are some contributors to obesity? So we know that genetics is a factor that increases a person's susceptibility for obesity. An imbalance of calories, so not burning the calories that one is taking in, can contribute to obesity. A lack of physical activity, we know that goes along with sedentary lifestyle. There are many things that are contributing to children not being as active, whether that's playing video games, playing on a cell phone, playing computer games, watching TV, and definitely environmental factors. And these environmental factors are factors that surround a child and can influence their food intake and physical activities. And these can be experienced in different settings like schools, communities, and of course, the home. So I want to give you a little bit of a background on the city of El Paso, Texas. So El Paso is the 6th largest city in Texas, and it has a population of 700,000 people. And El Paso is located along the U.S.-Mexico border, and it's actually just separated by the Rio Grande from Mexico. In the city of El Paso, 82.8% of their population is of Hispanic descent. And El Paso has a very high rate of unemployment, and it actually has a higher rate than the state average of unemployment for this particular city. In the city of El Paso, 17% of Mexican American children are considered to be obese. And Hispanics are 23% more likely to be obese in comparison to their white counterparts. So through my research on this population, I was able to find what some obesity determinants for the population are. And the Office of Disease Prevention and Health Promotion defines obesity determinants as factors that affect a person's ability to eat a healthful diet, stay physically active, and achieve or maintain health. So the first obesity determinant that I identified was cultural beliefs. Culture is intimately tied to diet for Hispanics, and I speak from experience because I am Mexican American. In our culture, food does not just provide sustenance, but it is what bonds our families and our communities together. And sometimes this type of interaction with food can promote overeating and can also promote eating unhealthy food. In a study that I found through my research for this presentation, the study involved Hispanic mothers, and many of the study participants identified a chubby child as being better than a thin child. And this misconception that prefers children who are a little bit on the heavier side is something that I've even experienced in my own family. Cultural beliefs can often be a barrier for Hispanic families in adopting healthier lifestyles, for oneself and for our family. In the Hispanic culture, eating is a culturally sanctioned way of coping with stress. And many times, the foods that are eaten to cope with this stress are foods that are very high in sugar, or things like bread, for example. The next obesity determinant that I identified was the infrastructure of the city of El Paso, Texas. So in 2013, a community needs assessment of the city took place, and it was determined that the city's growth factors really need to be evaluated so that modifications can be made to the transportation system of El Paso, Texas. For many families that are of lower socioeconomic status, public transportation is a way that they get around the city. And there are a lot of families in the city who are of lower socioeconomic status who depend on this public transportation. El Paso has also been identified as a food desert. So a food desert is a community usually situated in a low-income area like El Paso, where there aren't a lot of healthy food retailers around in the community. It is also very common for towns to be that are near the border of Mexico to be food deserts. And usually the kind of foods that can be purchased in these communities are processed foods, and usually families are very limited to their access to fresh fruits and vegetables. Many Mexican border towns are not, many towns that are situated along the Mexican border are not a priority for local government, so a lot of money isn't necessarily invested in these communities for infrastructure that can lead to a family having a healthier lifestyle. Language is also an obesity determinant that I identified. 72% of the residents in El Paso speak Spanish and only 26% speak English, and this can make accessing healthcare information and communicating with health professionals, it can be a barrier. Limited access to healthcare and lack of health insurance, I think, go hand in hand. Many times, even though a child is born in the U.S., they will still have a lapse in health coverage, and this is for different reasons. Maybe the parents couldn't pay the insurance premium, or maybe the parents are afraid of applying for Medi-Cal, Medicaid for their children because of their own immigration status. So this definitely affects the children as well. So what are some potential interventions that I am recommending and, through my research? So CATCH is a program that was created by the Center for Disease Control, and this program promotes physical activity and healthy eating from preschool through middle school. And CATCH is actually considered a very cost-effective way of preventing childhood obesity. There are several elementary schools that are already implementing this intervention in El Paso, and so my recommendation would be that more elementary schools, more middle schools, if not all, would implement CATCH in their schools to promote physical activity for the children. I also think that it is very important to implement family interventions at schools or community agencies that families frequent. Research has shown that parents are highly influential and should be integral targets of any intervention that involves children. The intervention should focus on helping parents adopt healthier behavior habits and provide recommendations on how to deal with environmental factors that are out of the parents' control. Parent education classes that teach parents about basic nutrition, ways to cook traditional foods in a healthier way, and encourage physical activity can be a very effective intervention. And my last recommendation for an intervention would be to advocate for changes to the community that make it more conducive to living a healthier lifestyle. So the community really getting in contact with community leaders, advocating for more funding, for more green spaces, more parks where children can play, perhaps advocating for healthy food retailers to come into the community so that the families can access fresh fruits and vegetables, and really just going out there, getting to know who the key stakeholders in the community are that can bring about these changes. So what are my conclusions after conducting my research on this population? Obesity is a very complex and multifactorial problem that it's not just created by one's individual choices, but definitely the community where we live, play, and work also play an issue into this obesity problem, especially for the residents, the Mexican American children of El Paso. Identifying obesity determinants for a population is key for the development of interventions. It's very important to know what is affecting the community, what are the contributing factors to this obesity epidemic, and trying to address those factors, come up with interventions that will impact those obesity determinants. And lastly, interventions definitely need to be culturally appropriate. My research has shown that if the interventions are culturally appropriate, individuals are more likely to follow and be accepting of one's recommendations. And here are my references for this presentation. I want to thank everyone for your time today. Thank you.